Dr. Ravi Kamapalli. I'm a board-certified infectious disease, wound care, and obesity medicine doctor in LaGrange, Georgia, and Augusta, Georgia. And I'm bringing this discussion of nutrition to the spectrum of care delivery processes that I do. And this was a lecture that I had given on a webinar recently, and there was a request for a recording of it. So I'm re-recording it and will be posting it. My conflicts of interest are none except removing barriers to healing for infection, wounds, and obesity. And also, this discussion is for educational purposes only. And please consult your medical doctor for further guidance on this. The role of diet, particularly ketogenic diet, for improving insulin sensitivity is the discussion topic that was given to me. And me being an obesity medicine specialist and me having focused my own health, have understood this in a different manner. Hence, there was this request of this topic on a diabetic forum. We'll discuss on what is hyperinsulinemia and insulin resistance, and we'll come up with a well-formulated ketogenic diet and methods of improving insulin sensitivity and role of ketogenic diet and proper human nutrition and some practical tips. This is more of a guidance, not a completely nerdy lecture, but also not completely a general personal lecture. So please take it with a grain of salt. So what is insulin and why is it important? I mean, like we know that insulin is secreted by beta cells. It's in the pancreas that it gets mostly secreted. And basically pancreas cells, alpha and beta cells, and alpha cells secrete glucagon and beta cells secrete insulin, and they counteract each other. The main role of the insulin is to clear the blood of glucose and push them into the cells, mostly into the muscle and fat cells where they are used. And when the glucose stays in the blood longer, there is going to be problems that include non-ketotic coma. So insulin exactly is a growth hormone. Basically, it is a nutrient sensor and a growth hormone that has its own potential to cause more growth, whether it could be vertical growth or once the vertical growth is done, it could be the horizontal growth. So that said, what is insulin resistance and why does it matter is because once the main job of insulin is taking more insulin than normal, and the cells don't respond into the normal activity of insulin pushing the glucose into the cells and more insulin is needed, that's when we call it insulin resistance. Now, insulin resistance happens in all cells of the body, and these include the muscle, liver, and also insulin affects hyperinsulinemia affects all the processes in the body, and it affects nerves, blood cells, and also it basically needs more insulin once there is more glucose to do job that is normally supposed to be done. Now, most of the insulin levels are easily done, but most doctors don't order it because the understanding that we cannot do much about it because of the glucocentric model of healthcare delivery. So essentially, insulin can be easily ordered. Nowadays, more testings are done in Europe, wherein they're coming up with bedside testing for insulin that will come hopefully soon. And because we don't have medical providers understanding this, hence the reluctance to order. Anytime when there is high, in ketone levels, except when people are taking external ketones, the insulin levels tend to be low. And we'll talk about the concept of nutritional ketosis. So basically, like we discussed, if healthcare professionals must obsess over something, it should be insulin resistance, metabolic syndrome, type 2 diabetes in the context of chronic diseases. So normally if we have insulin, and insulin attaches to the cell, opens up the cell, and glucose insulin receptors are open, and the glucose goes in. When uh, when when there is insulin resistance, though, these glucose then the receptors are down regulated. All the receptors that are working well here cannot work, so then the cells become insulin resistant, and this can happen in uh, adipocytes. It can happen in skeletal cells, the liver, and basically insulin that promotes cell growth and differentiation does not happen easily, and more of insulin is needed to produce the same effect. So the proper metabolic actions are not going to happen. So now, what are the symptoms of it? Mostly people then can have, because the glucose is not transported into the cell, there is energy craving, and patient feel weak and shaky. And obviously, like we discussed, there could be more hunger, and also people can have abnormal uh, uh, problems with insulin resistance, including glucose levels elevation, fasting insulin level elevation. Also, I tested sometimes C-peptide levels that could be tested also. So, uh, underlying pathology of insulin resistance is the cause of major problems in health, which is metabolic syndrome, which is wherein 3 of the 5 is constituted as a syndrome, wherein people can have a waist circumference that is elevated, more than 40 inches for men, more than 35 inches for women, and a HDL that is less than 40 for men and less than 50 for women, and triglycerides that is more than 150, and blood pressure that is more than 130 or 85, and fasting blood sugar more than 100. Obviously, all this is going to be a problem that leads to complications of elevated insulin, elevated BMI, increased waist circumference, leading to hypertension, dyslipidemia, PCOS with elevated DHEA and testosterone level, and fatty livers, and gout, and skin tags, and hirsutism, and the skin discoloration and acanthosis nigricans that can be seen. So these are all clinical signs. But what we have to understand is that with all this insulin resistance, we can have high levels of insulin circulating in the blood. There is excessive fat storage in the liver and pancreas mainly, then leading to the diabetes and high levels of insulin and high levels of inflammation. Now, it's basically uh, to summarize it, insulin resistance is nothing but subnormal glucose response to either endogenous or exogenous insulin. Now, obesity can cause it, stress can cause it through the counter-regulatory hormones, and which are cortisol, growth hormones, catecholamines, and glucagon. These can counter-regulatory hormones help to maintain glucose, or in the morning sometimes when there is elevated glucose, the counter-regulatory hormones are trying to help the body maintain the glucose level. Now, this can happen through medications also. There could be glucocorticoid steroids that can be given, and antiretroviral HIV medications and oral contraceptives can cause insulin resistance. And pregnancy and puberty are the physiological causes of insulin resistance, and these are associated with lipodystrophy, and people can have insulin antibodies, and there could be genetic defects that can cause type A insulin, and also autoantibodies then can cause type B insulin resistance. Normally, when we are told there is a problem, then we are told, oh, there is a lock and key mechanism wherein the glucose is not able to enter the cell, and because of the receptors that are not working, so there is more glucose outside, and there is low glucose intracellularly. That they call it as internal starvation. Whereas it is contradictory to the normal understanding, because even when there is that quote unquote internal starvation, that de novo lipogenesis that happens in people with obesity and diabetes continues to happen. Now, that is a different paradigm that we have to get rid of. Understand that in a normal cell, if there is more glucose, then it converts into fat. Now, when there is more glucose inside, it's more of a overflow paradigm. So there is glucose in the cell, but then that glucose then converts into fatty acids, and that goes on to be stored in the fat or other places that it needs to be stored in. So when the only way then to reverse diabetes or obesity is not putting more energy in, that is using low carbohydrate diets versus using fasting or intermittent fasting. Now, there is different underlying mechanisms. There's like increased phosphorylation, increase insulin receptor substrates are increasing insulin receptor substrate action through degradation via mTOR activity, and also PI3 kinase activity decreasing, and AKT3 activation decreasing, and other mechanisms which is myriad. I mean, like this is a complex pathway that affects insulin and insulin resistance, causing a lot of problems, including metabolic issues, including fatty liver, diabetes, and cardiac issues. Coming to the glucotoxicity, why are we worried about diabetes is because of glucotoxicity. At any given time, blood has only 5 grams of glucose in it. And the more the blood that carries sugar, then because glucose is a rigid planar molecule, then it damages the cells by causing glycation. Now, wherein proteins and sugars, when they combine, form something called as early glycation products, which go on to become advanced glycation end products, AGEs, AGEs. And problem with this is that if glucose is the problem, fructose is 7 times worse. So we are told to eat fruits, and fruit juices are good or something like that, we are told. But we need to understand that fructose is only metabolized in the liver, whereas glucose can be metabolized in the whole body. That's a worse problem. So if you are told to eat fruits and fruit juices, we have to understand that we are causing glycation 7 times worse than glucose. And that too, it becomes more worse when people end up having fatty liver. So in these glycans, then if people have, say, arthritis, inflammation, the joint problems, and these are all where suppose if diabetic has Achilles tendon problems, that is glycation of the Achilles tendon. So that causes them to have a rigid foot and all those other problems. If you can see here, red blood cells pre-glucose load are normal, but post-glucose load, there is clumping of the red cells. That is a major problem with glucotoxicity. Now, there are different mechanisms we'll talk about, but insulin resistance and hypertension mechanism is significant. Is one of the complications of insulin resistance, like elevated blood pressure in the metabolic syndrome criteria. Hypertension is one of them. Insulin resistance and with hypertension is because of sodium that is reabsorbed. So when the insulin levels are high, the sodium is reabsorbed. Along with that, the fluid is reabsorbed too. It happens in the proximal tubule. It happens to in the distal tubule also, and also loop. And also hypertension in insulin resistance can happen because of sympathetic nervous system activity, and also increased calcium concentration in smooth muscles of the cells that causes hypertension. So insulin resistance and hyperinsulinemia are significantly associated, and we need to make sure and pay attention to this. Now, the major problem is with insulin resistance is abdominal fat. The subcutaneous fat is not the problem. It is the abdominal fat that is a problem with hyperinsulinemia and insulin resistance. There is increased free fatty acids that are floating in the system, in the blood, and that causes the problems. Now, people are sitting more over time, not actively working, and it's the genetics and the lifestyle that influence the problems and increase the free fatty acids and leading to dyslipidemia. We'll talk that's a whole another lecture of the topic, but in short, dyslipidemia is decreased HDL, increase in small dense LDL particles and increased triglycerides and increased thrombolysis and endothelial dysfunction and inflammation leading to atherosclerosis. And that is a major problem with abdominal fat increase. And most of the metabolic health problems are leading to the outcomes in COVID, for example, are related to this inflammation that is causing. Why does this abdominal fat accumulation happen? Is simple mechanism that we don't pay attention to, wherein we have these molecules like in the cycle of Krebs cycle. There's more triglycerides that are produced. Now they have to be stored. We have an enzyme called lipoprotein lipase, wherein insulin increased lipoprotein lipase activity, which degrades the triglycerides into glycerol and fatty acids, and also activates the GLUT4 transporter, and that pushes the glucose into the cell, wherein now again the glycerol and fatty acids form together and get stored again into triglycerides. But the problem is that elevated insulin then does not let the fat come out, and we need to reduce that hormone sensitive lipase. But the problem is in high insulin level we cannot reduce in high insulin level the hormone sensitive lipase activity is kind of suppressed. So that's where by eating high carbohydrate diet, we increase the insulin levels in the body, causing the hormone sensitive lipase not to act. That is, the fat gets locked away. So how do we measure this problem? It's a simple process. If you can get our physicians to order fasting insulin level, and also if we can have them order fasting glucose, it's a simple calculation of homeostatic model for insulin resistance, wherein it's a non-invasive way of calculating, wherein HOMA is a method wherein it's an assessment method of beta cell function of insulin resistance from basal fasting glucose and insulin. It's a measure wherein we need how much insulin does it take to hold the blood sugars in a fasting state at a given fat store of the person. So it's a huge role. HOMA-IR assessment has a huge role in chronic disease process. And there is another comparable test we can order if you don't want to do this scoring. It's called LPIR. It's a lipoprotein particle insulin resistance testing that could also be done, but that's more costlier, I guess. So another simple way, if is a non-invasive way in wherein it's a ratio of waist to height ratio, wherein you measure the waist at the umbilical level and measure it. Normal is equivalent to, it's like BMI of 45 equivalent to almost 0.5. In males, more than 0.53 is abnormal. And basically, when it is more than 0.57, BMI is almost gone to 30. So almost more than that, it will be obese. So the idea is that when we are storing more fat, the subcutaneous tissue is full. And then our abdominal fat increases, intra-gut fat increases, that leads to inflammation and causes more. It's a predictor. It's a waist to height ratio more than 0.5 is a predictor of insulin resistance and is linked to cardiac disease also. Now, what is a well-formulated ketogenic diet? Now, there is many dietary patterns in which people can get better and improve their capability to become less insulin resistant. Obviously, low-calorie diets are there, and there is other diets including Mediterranean diet that is touted, and also there is Ornish diet wherein the carbs are high, but then the protein is low, and also the people are able to still reduce their fat mass. But I don't know how long it can be sustainable. But as long as they do exercise, I guess it could be sustainable even with regular Mediterranean diet. And there is the carb level is if with Mediterranean the carb level is 40%, whereas the protein level is 0.8 grams per kilogram. Whereas in a paleo diet, it does fall into less than 30%, which is generally acceptable. But the problem with these three diets comes down to whether we are able to burn our fat. The only way in which we can burn our fat when we kind of make it a well-formulated ketogenic diet, wherein we are able to reduce the carb load, keep the fat, keep the protein better, but increase the fat. So basically, wherein ketogenic diet is less than 10% of carbs and less than basically coming down to more than less than 20 grams, and then coming down to eating 70 to 75% eating to satiety. The fat is eating to satiety, whereas the protein is 15 to 20% and carbs are 5 to 10%. Essentially, the standard ketogenic diet, there is other kinds, including Atkins diet, wherein fat is 50% and protein is 40%. And the standard ketogenic diet is 70% fat and 5% carbs and 25% protein. But what I do is, once you get accustomed to the style of living and style of lifestyle, and you become fat burning animal, you will figure out that whole process, and it is totally individualized. So this is not a diet, and it's just a lifestyle. So you will get to understand it once you do it. Once you do it again and again, you will know. So that what happens is, we have to understand the concept of nutritional ketosis, wherein people say, oh, ketogenic diet is bad for you. In reality, it is not bad, because it is without nutritional ketosis, without ketones bodies being there, we would not be existing as a humanity. The reason for that is, in a state of fasting or in a state of deprivation, our body stores produce ketones. These ketones are the ones that supply the energy. In fact, apart from fat and glucose, it is ketones that really supply the energy. Obviously, when the muscles break down, the protein is also there, or when we eat protein can be an energy supplier, but in reality, protein is the building block. So let's talk about this concept of nutritional ketosis, is wherein the ketone levels, that is, it's only blood ketone this concept is for, but it's a measurement of beta hydroxybutyric, which is one form of ketone. There, I'll show you the different ketone molecules, but here it is 0.5 to 3 millimoles, basically, wherein you have when we are eating a very low carb ketogenic diet, and you have wherein you have a nutritional ketosis of 0.5 to 3, then you are in that zone of optimal ketones. Now, why should we be worried about ketones? Is because of DKA, diabetic ketoacidosis. Most than likely, most human beings that are not type 1 or not have any autoantibodies against their insulin producing capability, they do produce insulin. Without insulin, we don't have life. So obviously, in people who have type 1 diabetes, or who don't have any endogenous insulin production, then the ketone levels go up, and that's when they go into a state of diabetic ketoacidosis. That is when diabetics can get infected, and they have high resistance, and also there is high ketone production. So in people who are fat adapted, then their ketone levels tend to be in the normal range. And obviously, there is this concept of nutritional ketosis is wherein your genes and your epigenetic factors, which is a totally different discussion we can talk about later, our genetic expression is the best in the state of nutritional ketosis. So we need to understand this concept and become fat adapted, and understand that how to get to this state of living is what we need to understand. Now, wherein we can limit this with the basics of this is dietary carbohydrate restriction, moderate protein, and have your liver produce that ketones from fatty acid metabolism. Ketones can support our brain energy, and we need to understand that this does not lead to ketoacidosis. In fact, like I said, in pre-agriculture ancestral eating patterns, the ketones were very much important. And ketogenic diets were used long before 1920s, when they were initially pulled out for usage for epilepsy. But long before, even in late 1800s, I think there was a Banting diet and all those other books that were written regarding this. So it is a ketogenic lifestyle is a kind of a not a new lifestyle. It's a really the oldest lifestyle, and in fact a proper human lifestyle. So we need to eliminate most of the sugars, including grains and potatoes, and also we need to can restrict to non-starchy vegetables, seeds, oils, and cheese or meat and eggs, and basically insulin doses. When we are doing in the proper ketogenic diets, the need for insulin goes down and the human cravings go down. Obviously, I have done continuous glucose monitoring on myself, and I have noticed my glucose line to be flat. So, and it is the proper human lifestyle. There's no reason not to be in a state of nutritional ketosis, which I am in right now. Now, if you look at this truck here, I mean, you're seeing a big truck. This is a lot of energy. But this truck is, if you imagine this truck to the human animal, this truck is running on this gas tank, that is carbohydrate gas tank, but it is carrying a huge tank of gas here. So that is what we are. We have a lot of energy that we are carrying around, and the more the carbohydrates we eat, because of the lack of activation of hormone sensitive lipase, the fat tends to be stored up, and we are logging our fat on, and we are carrying this fat to be used at a time when there is no energy. But the problem is, once the insulin is elevated, we're not able to access that fat. So insulin levels have to be low, but you don't have to be really in a continuous state of nutritional ketosis. And for optimal living, we can go in and out of nutritional ketosis. But proteins can increase insulin, but we need to understand that there is glucagon that is counteracting that effect of increase of insulin by proteins. So we need to understand that protein intake is very much necessary. So avoiding proteins is the worst thing that human beings can do. So, like we said, we talked around that ketones, that insulin is very much important for in a state of high insulin state. The fluid retention is happening. And also during ketogenic diet, when the insulin goes down, the sodium consumption needs to be increased, because if we don't do that, then we'll end up having problems with quote unquote keto flu. And we need to understand that salt replacement might be needed. And like we said, ketones were discovered long before, even in 1850s, and diet was being done. This kind of diet is being done by Inuits, and also problem is because of a lot of recommendation that happened in mid 1980s, late 1970s to early 1980s. The dietary recommendations changed, and now again, because of new studies that have been done from 2000s, there has been resurgence in this research. And there's multiple studies for low carb nutrition as a real process. I mean, if anybody tells you that there is no evidence, please have them call me or look up the evidence before they talk. And like I said earlier, there is ketogenesis. Now, what happens with ketones? It's a ketone bodies are produced mostly by nutritional ketosis with affecting from the liver. Now, this is a ketogenesis enzyme pathway. We're not going to go details in this, but you need to understand that acetoacetate is formed from acetyl-CoA, and acetyl-CoA spontaneously gives out acetone, which does not have much of any metabolic effect. But the role of ketones is as a fuel source, but also has a signaling property. It has an anti-inflammatory property and metabolic property. And beta hydroxybutyric acid is formed because from excess acetoacetate, and it's stored in the blood, so it is moving in the blood and it is water soluble. Now, excess ketones don't cause kidney failure, by the way, just making sure that we understand. And the beauty is that there is in the liver there is mitochondria, but the problem is the mitochondria in the liver are used to produce the ketones, but they cannot be used because there is a hormonal problem for using that ketones in the liver, and then those ketones are pushed out into the blood, but the extra hepatic mitochondria can use it. So like here, this is acetone, and two acetone come together, and we form acetoacetate, and then these get the acetyl CoA combines together to form acetoacetate, and then acetone gets released, and we get beta hydroxybutyrate too. So obviously, it is not that of a complex process, but it is a water soluble molecules and high energy molecules that help us. Now, we were talking about these pathways wherein the glycolysis happens and end up with pyruvate production, and this pyruvate production produces the acetyl CoA. Now, acetyl CoA comes into this Krebs cycle, and also then in this Krebs cycle, the three of the fatty acids are formed, and these fatty acids that are formed here then combine together, convert into triglycerides. The same thing happens here, wherein all the citric acid cycle and the lipid lipolysis cycle come together through this common molecule of acetyl CoA. That is where the crux of metabolic health happens. So we need to understand that for ketogenic diet, and this is a complex process, and nutritional ketosis happens when our carb intake is reduced. Now, like I said earlier, the liver does not use it, and then that beta hydroxybutyrate is then released, and from there the ATP comes. Now, ketogenesis can be orexogenic through the pathway of AMP kinase pathway, and there is increased gamma aminobutyric acid, and there is reduced reactive oxygen species production through ketones. That's very important. It has a huge implication in healing, and also there is increased adiponectin that gives more circulating adiponectin, and basically that helps with satiety. And also an anorexogenic process wherein the circulating free fatty acids can cause this anorexia, and the ketosis causes increased CCK and reduced ghrelin presence, and also reduced AMPK phosphorylation. So all these processes are very much needed. This is a complex relationship with nutritional ketosis, wherein when any person who is in nutritional ketosis can have a little bit of control over their eating habits. Now, can this be insulin resistance be reversed? Yes, this can be if you are following a certain processes of course. There is medications. We are not going to talk about medications during this lecture, but we are mostly focusing on nutritional lifestyle. And very low calorie diets can reverse it, because they take off the fat from the pancreas and then the liver. But also it can be done when you have weight loss surgery, gastric bypass surgery, or lots of exercise. But the problem with exercise is when you do too much exercise, you become hungry and go back and eat, or have a nice Gatorade drink that has a lot of unnecessary calories of sugar or fructose in it. And yes, they sell it with the electrolytes, but the sweetness to it and all the 0 calories to still stimulate insulin. But the only sustenance way in which we can keep this going is a proper human lifestyle with therapeutic carbohydrate restriction. That is the colloquial right term to use instead of calling it low carb, high fat, or low carb, healthy fat, or ketogenic lifestyle, I like to call this lifestyle a therapeutic carbohydrate restriction. That is in reality the way in which insulin resistance could be improved. Now, as you can see, this doesn't take. It only takes 3 weeks if we get into this ketogenic lifestyle to improve the insulin resistance. That process is totally the degree to which it improves depends upon the person's insulin sensitivity, and all these factors are depending upon where we are starting. But obviously, if we can get them into the state of nutritional ketosis faster, then we can get them to burn their fat faster. And obviously, it is important that when people are doing this kind of dietary lifestyle, we need a well-formulated ketogenic diet. They need to be monitored. We need to use biomarkers, including testing for hemoglobin A1C, and use advanced techniques like continuous glucose monitoring, fasting, blood sugar testing. Obviously, hemoglobin A1C is a 3-monthly thing, but with now continuous glucose monitoring, even within 2 weeks, we can figure out where we are. So this is very much needed to reverse metabolic syndrome and diabetes and obesity. Now, I just want to quickly mention this study wherein they took people with who were given very low-calorie ketogenic diet and also very low-calorie diet. So it's a ketogenic diet that is very low-calorie and a low-calorie standard low-calorie diet, wherein they kind of used swapped them 15 patients, and then they had a washout period, and they then went to the other diet. They found out that these patients were tested at baseline and at 3 months and 12 months. And what happens is the very low carb ketogenic diet, patients had lower BMI. They had improved hemoglobin, that is hemoglobin A1C, when compared to just the low calorie diet. And also the anti-diabetic medications were reduced a lot more than the low-calorie diet. So obviously, something is there with nutritional ketosis, something good enough for us to really look at this proper human lifestyle as a solution for our patients. Quickly, we'll come to the why keto diet has a potential to reverse insulin resistance is because low-calorie diet has high fat. Low-calorie, high-fat diet has a potential to reverse insulin resistance. There is no gold standard for each dietary symptoms with insulin resistance, you see. We can do it through calorie restriction, where we restrict the carbohydrates, but we need to increase the overall satiety with the ketones. And keto diet provokes that filling response, and basically our cells feel content, and that but still support the calorie restriction. And body fat reduction happens through by reducing our visceral fat. So we are burning our visceral fat, and there is potentially improving signaling molecules that are there, and also improving metabolic health happens. Carbohydrate restriction is one way, wherein only macronutrient is the carbohydrate that causes significant fluctuations in the blood sugars. By restricting them, we are restricting the spikes, and that increases the insulin sensitivity when the spikes are not there of the insulin spikes because of the carbohydrate intake and glucose spikes. And ketones, when we start burning fat, then we produce more ketones, and these play a crucial role, like with our genetic expression, and also help with metabolic health improvement and improving longevity. Now, how can we minimize insulin resistance is through increasing the maximizing nutrient density. Now, how can we do that is by targeting and eating high quality protein, or nutrient dense protein. And obviously, in vegetarians or vegans, that might be a problem, but we need to figure out how we can compensate for that. Say, if they are allowed to eat eggs, then increase the egg content. Or if you're eating plant protein, then obviously use exercise to compensate, to increase the increase the empty calories that are being taken. Now, also we can do insulin resistance is improved because can be minimized because when you're carb restricting, the insulinogenic effect of carbs is reduced, and obviously we talked around the pulsatile response to carbohydrate is also avoided when you are not snacking, and obviously when you're taking when you're not when you're only taking the meals in a time restricted manner, then your glycogen in the liver is depleted, and your insulin is not stimulated. And exercise is very important, and mitochondrial density increases with exercise. And specific diets to minimize insulin resistance would be obviously low carbohydrate intake, low glycemic food intake, and also increasing dietary fiber if possible, and increasing protein intake. Obviously, that the best way is to do carbohydrate restriction, avoiding snacking, and avoiding processed carbs. Industrial seed oils is a whole another talk, and seed oils are really some things that have to be graded at the level of processed carbs. And obviously, seed oils and carbs kind of go together, and they need to be avoided too. And intermittent fasting, avoid snacking is very much important. And building muscle, obviously, meditating and relaxing and giving adequate sleep time and exposure to sun is very much needed. Now, if I can give some significant one slide practical tip, this is going to be it. We need to avoid processed vegetable oils and foods, have real food, and drinks without sugar or fruit juices. Fruit juices, I avoid them like poison because they are nothing but fructose poison. You just have you might not have a glucose spike, which is what the argument is, but they really cause the advanced glycation end product 7 times. So be careful with fruits. Though we are told fruits are good for us, but seasonally fine. But that is when you get to your fat mass that is reduced, then you can try and eat a little bit of fruits according to the seasons that of the fruits that grow locally, not the fruits that are coming from all the way from another continent. Anyhow, it just comes down to learning to your body, understanding what you eat, when you eat, and how much you eat, cutting carbs, prioritizing protein, and filling with fat. There's many nutritional advocates that are promoting this kind of lifestyle, and obviously that is for me it has worked out. And depends upon also including fasting and intermittent fasting, understanding that, and it's all about satiety and nothing about calorie counting. We need to understand that stress hydration is very important. Without hydration and adequate salt repletion, then you might end up having trouble. But please be careful and talk to your doctor before you start this lifestyle. You need to understand that insulin resistance is a huge problem. If it's not properly managed, then we'll end up with diabetes and pre-diabetes and diabetes, which is affecting a huge population in US and across the world. And modifying one's diet using therapeutic carbohydrate restriction is the key to this. And there's many such studies that is available. Please look out. And when somebody tells you there are no studies, then please be careful, because the research that person does not know it then. So processing food is very much not good when it is carbohydrate included. When there is no carbs, obviously processing with carbs, or when even the protein is mixed with any sugars, that is a problem. And we need to, if you are eating plants, then plant food could be carefully selected for the nutrient density of the plants. And we need to avoid frequent meals, and snacking is a bad idea. I mean, I use bridging techniques like some high-fat nuts could be eaten, or use coffee or tea without sugar or milk in them. And also, once you reach to your personal fat threshold, life is there to be enjoyed. But we have to understand that carbohydrate and also cocaine or any drugs have the same pathway in the brain that light up a nucleus called nucleus accumbens. And obviously, we do have to enjoy our life, but that does not mean we have to enjoy now and suffer later. So the idea is how we can live a proper life and still enjoy occasionally when we have special occasions, and only rarely do it, but also understand why you're doing it. So we need to understand that there is no magic pill. There is no magic pill. People ask me, I mean, can I have get rid of this problem with my infection, which is an end game that happens when people come to me as an infectious disease doctor. We need to realize that this whole process is a food addiction pathway, and we get blinded to the consequences of processed food. Let's understand that we have to avoid mass medicine mindset when we have to personalize and create proper human nutritional lifestyle, and monitor and just do it and taper each treatment per each patient. So please understand that this discussion just a discussion as an educational tool, and obviously we'll be doing more discussions. But please use people, process, and technology. Use things that are out there, and talk to your healthcare provider, because there is no reason why you should not improve your metabolic health and live a fullest life that God has blessed us to live. Thank you very much. Have a great day.